Hello and welcome to Dental Practice Masters. Today we're going to talk about some relevant topics regarding the COVID-19 outbreak as it pertains to dental practices and small businesses. The topics today will include your emergence strategy, emergency and urgent dental treatment, protecting the team, your marketing, and rescheduling patients or placing them on a short list, and a few other topics. We will be releasing another video about paying your team, accessing extra funds, and legislation as well. Should you have questions, feel free to email us. Our email address is listed below. We will do the best we can to answer them, and we'll also try to include them in our next videos. Before we begin, I need to give a disclaimer. We are not an HR company, attorney, or an accountant. We have, however, completely immersed ourselves in this crisis and been in constant contact with these professionals in all aspects of this issue in an attempt to formulate plans that can help many practices survive and thrive. This should not be taken as legal advice, accounting advice, but rather a tremendous resource in the time where information is everywhere, but nowhere in particular. You will note that this video has today's date on it. All subsequent videos during this crisis will have a corresponding date. The reason is that this issue is so incredibly dynamic, and often information and advice become antiquated by the next day. For more information and consistent updates regarding legislation and accounting strategies, visit the website at the bottom of the screen. This is a fantastic accounting firm representing many dentists, and they're dedicated at this time to keeping dental practices afloat. So first and foremost, let's talk about your emergence strategy. The entire landscape of oral health in America may be changing as a result of this layoff. Our inability to treat moderate caries when there's no pain involved, for example, will be shifting so many MOD restorations to endo, buildup, crowns. Patients not seeing a hygienist will not only have periodontal issues, but the periodic exam will be absent for many patients for a decent amount of time. Treatment plans will be antiquated and require so much more effort to set and exceed expectations at the close of this. The list of things goes on and on. What this means is that our emergence strategies will set us apart when we are diligent and thoughtful. All this said, we're not going to spend all that much time on this today. The difference in strategy from 60 to 90 to 100 days, for example, makes these strategies remarkably different. Stay tuned, because we're going to be focusing very heavily on these strategies when it is time to do so, and we'll have ample time on our hands to do it. But we're going to be focusing on the things that are much more urgent in nature right now. Emergency and urgent treatment. Last week, the ADA published some guidelines on what constitutes emergency and urgent treatment and what should be considered elective. Now, many of you have considered those simply guidelines and understood that there were no mandates on this topic. Some states have released these mandates that are needed to be followed. The problem is that so much of this information is subjective in nature. What if a patient is in pain on one tooth and they need a 3-unit bridge with implants to remedy the single tooth in pain? What about a loose implant and 100 other gray areas that are inevitably going to make you struggle on a daily basis? We simply can't think of every single question and provide guidance on it, but we can help you know how you should be viewing this. It's critical to think of the reasons why we are allowed to see patients in the first place. We're trying to keep patients out of hospitals. This is why pain, swelling, and infections are part of what we can treat. If you find yourself in a gray area, view it through this lens, seek some extra advice on it, and you'll be much more likely to be safe. Your patients and your team will be safer as well. We're still not certain how insurance companies will reimburse during this time. We also know that if attorneys who find themselves with a little to work on might target dental practices that have been providing treatment. There is a lot we don't know. As such, we highly encourage you to be overly protective with what you're doing. This should include, but not be limited to, a telephone intake form, which includes the patient's name, the employee taking the call's initials, a checklist of the reasons you see patients, and have the patient and the person on the telephone put the check mark in the corresponding box. a screening section which includes questions such as if they've gone out of the country recently. What is their temperature today? Have they had any signs of symptoms of COVID-19? Have they been in contact with anyone that may be infected? Have they been practicing social distancing? This needs to be scanned into the patient's chart for when they arrive, if they arrive. This should also include an ASA section to give you a rough idea of the patient's ASA levels. If there are red flags found on the call and the patient would fall into the ASA 2 or 3 range, the patient should not be permitted to walk through the door without specific approval from the treating dentist. We need to keep these patients safe. Next, a consent form. The patient needs to fill this out immediately when they come into the office. The consent form is similar to the intake form, but it also includes a statement about the potential risk the patient has even when stepping into the building. Clinical notes need to be extremely detailed at this point. We highly suggest that your notes state in no uncertain terms exactly how the patient qualifies as an emergency or an urgent treatment patient. If you choose to take on extra risk and enter into any of these gray areas with regards to qualification, your explanation should be very detailed and should provide an extremely strong case of why you feel it is the right thing to do for this patient in particular in this particular situation. A COVID-19 policies and procedures manual should be kept on hand at all times for your practice. Each and every time a policy or procedure changes, which it will, and it will likely on a daily basis, we strongly urge that you copy and paste the old one into a new document. Make the necessary changes and save it dated for that day. This shows that you're consistently being on top of everything. A document that the patient reads and keeps, and the receipt of the document noted in the clinical notes, detailing the steps that you're taking to keep them safe. We will explain some of those in a minute. You want not only to be doing these things to keep everyone safe, but you want to ensure that everyone knows you're doing these things. Remember that people who do not truly understand the nature of our roles in this crisis may think we are irresponsible or care more about profits than we do safety. Profits? We do not want patients going home telling their friends that they received dental treatment and their friends make assumptions about us being irresponsible. They've already been social media outlets that have blown up with negativity towards cowboy dental practices. To protect against this, we recommend a few simple steps, aside from total responsibility regarding who you see and following all guidelines. First, when a patient is calling asking if you're open, the answer is not yes. The answer is something along the lines of, we're open to see emergency and urgent procedures in an attempt to keep patients out of the hospitals. Are you having an issue? Next, each patient should be educated when they're in the chair as to why they have qualified to be seen. This will further enhance the fact that we're not just seeing anyone. Finally, your social media, Google, website should all have statements present that articulate exactly what you're doing and why. These statements can be brief, but is one more piece of the puzzle. Although these strategies are not bulletproof, it certainly can eliminate some pain points. Next, it is very much your responsibility to protect everyone involved. First, employment during this time is totally optional for your team. To summarize the employment law in this particular situation, if they feel there is a reasonable risk to their health and their health is in danger, they cannot be forced to work, nor would you want to force them to work. At this point, anyone could make the argument that there is a reasonable risk. If you have team members working, you're permitted to have them take their temperature each morning, put it in a logbook. You should be very forward with your team and preach the responsibility of social distancing. They should be taking this very seriously. Please ensure that they know that if they were to be irresponsible and contract the virus as a result, it could be absolutely disastrous for the practice and obviously place their coworkers and families at risk. We encourage a morning message to everyone to asking if they have any symptoms for that day. This is simply one more step that we can do to make sure that they know how serious this is. We suggest having only one patient in the reception area at any time. Between each patient, we highly encourage one designated team member to wipe everything down that was touched. Door handles, faucet handles, pens, counters, chair arms, everything. Prior to being seated, the patient should be led to the restroom for a thorough hand washing. They should be then given a 1% hydrogen peroxide solution to rinse for 60 seconds. Use a rubber dam whenever you can. Next, let's talk about your marketing. This is a tough topic for many practice owners right now. Some of you will likely be paying SEO companies to help you obtain a proper Google position. Online marketing is king right now. Some of you also may be doing pay-per-click digital marketing. Unless you find reasons to do so, we highly suggest that you turn off all pay-per-click campaigns other than those that focus on emergencies, if you are in fact seeing emergencies. We would like to offer a way to look at the recurring expenses of your organic SEO campaigns. To clarify what we're talking about here, if you'd like to grow your practice, likely you are paying a great company to help you get to the first page of Google or stay at the first page of Google. Let's focus on the stay at the first page of Google position for our analysis here. If the recurring expense will totally break you, well then by all means get rid of it. That said, a good position in organic search engine presence is extremely difficult to obtain and very easy to lose. This is likely one expense that you want to gamble on the survival of your practice. A good SEO position will be so incredibly important as part of your emergence strategy. We'll be helping with that in detail. Our incredible dental marketing partners at TNT Dental will be creating time-specific updates on all things dental marketing on their blog at the web address listed below. Should you have questions or should you want to discuss your marketing-specific emergence strategy, feel free to reach out to them. They have proven for several years that they're an awesome company, an amazing asset for your dental practice. Next, should we reschedule patients or put them on a short list? Now, there's some nuances to this question to consider. Much of this depends on how far out your particular state has closed you down for elective care. Say, for example, you're closed down as of now until May 10th. There are some significant drawbacks to simply rescheduling all of your patients during this period of time, even those for the week preceding this. First, between now and then, many things with our patients' finances may change. We do not want a bunch of patients canceling appointments or no-showing when we're finally able to get rolling again. Next, many treatments plans may be outdated by the time we're back in business. To be able to appropriately schedule patients for the weeks when we're able to treat, changes in patients' treatment plans may result in more or less time required on the schedule. As such, we suggest that you stay only a week or two in advance with your scheduling at this time. That's our advice for the day. When you receive a more definitive answer about your abilities to reopen, at that point it'll be quite important to mobilize the entire team to very diligently appoint patients strategically. We'll obviously be addressing this in the appropriate time. Thank you everyone for spending the time. We hope to see you soon enough with guidance to help you all get through this. Count your blessings.